Three phenomenal women from the civil service. We had one of them with us last week and she is back, but they are just a few of the phenomenal women who work in the civil service to make this country work. So this evening his special guests are Dr. Dolores Stapleton Harris, Permanent Secretary in the Ministry of Health. We have Financial Secretary in the Ministry of Finance, Hilary Hazel, and Chief Executive Officer at the Tourism Authority, Raquel Brown. So I'm sure that they have exciting presentations for you, and the ministries and departments that they represent, of course, will indicate that they also have important updates for you as well. But at this point, we're going to break and show highlights from the past week because we had two significant events over the past week. The first being the launch of the rollout of the vaccine, and the second was the handing over of vaccines from India. They were gifted to St Kitts and Nevis, and we received them just yesterday. So sit back, relax, and we're going to have a quick break, show you those highlights, and when we come back, we'll tell you how you can participate in the program, and we'll hear from our guests.
Today we're at the Newtown Health Center where we've had the official launch of the COVID-19 vaccination program. We are so pleased to have had quite a cross-section of individuals who were represented here today and taking the vaccine. We had members of the cabinet, we had persons from the medical fraternity, doctors and nurses alike, and we've had quite a number of other persons from the clergy, from immigration, from police, you name it, they were all here to take their first dose of the AstraZeneca COVID-19 vaccine. And so we all got our COVID-19 vaccination card to indicate that we would have taken our first dose of the vaccine. Once we come back in 10 weeks, we will have our second dose, and then once we got that second dose, then the cards would be stamped at the front with the Ministry of Health stamp, and that is to finalize that you did receive both doses of the COVID-19 vaccine. A reminder that the vaccine helps us to ensure that persons do not have severe illness or death. And so we're encouraging persons to step forward and take the vaccine. Get all the facts that you need to get. The Ministry of Health provides all of the information. The facts on the vaccine are on the covid19.gov.kn website. And so we're asking you and urging each and everyone to come out and get your vaccine. Look at the information, get all the information that you need, whatever makes you comfortable. But I can assure you that we have all taken it so far, and I'm feeling good. My arm is good. It was a vaccine, and so I'm excited about that. And so I'm looking forward to my second dose to say I'm completely vaccinated for COVID-19. And as the science continues to evolve, I'm sure we'll find more information and more benefits as to why you should take the COVID-19 vaccine. But for now, I know that since I've been vaccinated, I lower the risk of me getting severe illness or death from COVID-19. I also know that I'm protecting myself, my family, and my community. So I'm asking everyone, get the facts and then get the vax. Today was an example that it is safe, and we urge each and everyone, when it's your turn and your stage come around, to get vaccinated. As we progress, we will provide more information as to the next stage and who will be next. And so look out for that information from the Ministry of Health. We'll keep you informed, we'll keep you updated, we'll let you know how many persons have been vaccinated, and we'll let you know when it's your turn that you can make your appointment calling 311 or any of the health centers. So go ahead, get your vaccination.
Thanks to the nation's unified response, the spread of COVID-19 has been contained. St Kitts and Nevis, therefore, announces the opening of their border on October 31st, 2020. The success of this strategy requires effort on everyone's part. People from all walks of life must keep practicing social distancing. Maintain a separation of 6 feet or 2 meters indoors and 3 to 4 feet or 1 meter outdoors. If this isn't possible, masks must be properly worn. Businesses can provide hand sanitizer, conduct temperature checks, record customers' contact information, and manage crowds. Clean and sanitize high-touch areas regularly. Dividers or staggered seating can be used to maintain proper social distance. This protects workers and customers and prevents the spread of disease. We all have an individual and collective responsibility to avoid large social gatherings. These types of gatherings are deemed as super spreader events. Taking disease prevention seriously will enable a worry-free return to normal life.
Welcome back to Leadership Matters. My name is Jacqueline Bryan, your host this evening. And Leadership Matters is a program through which the Prime Minister of St Kitts and Nevis, Dr. the Honorable Timothy Harris, updates you on matters of national importance. And you would be aware that recently we've had quite a number of things happening, and this is one of the ways in which he keeps you informed. Of course, the program also allows for you to pose questions and make suggestions, so it gets pretty interactive, and we're happy to be here with you this evening. We're going to begin with the presentation from the Prime Minister, and he will be followed by the Permanent Secretary in the Ministry of Health, the Financial Secretary in the Ministry of Finance, and finally the Chief Executive Officer from the Tourism Authority. So without further ado, we'll hear from the Prime Minister.
Thank you very much, Jackie. My fellow citizens and residents, welcome to another edition of Leadership Matters, an informative, interactive public forum where we discuss matters of national interest. We do so in the finest tradition of democracy and accountability. We in leadership open ourselves to constructive engagement with members of the public. The big news this week continues to be about our vaccination rollout program. The successful launch of our COVID-19 vaccination program last Monday continues to dominate the news, increasingly so as our public education program gains momentum. Success has many faces, and indeed persons from all walks of life and every strata of society, from the head of state to the ordinary folks, understand the urgency of us getting vaccinated. From a turnout of 70 last Monday to over 340 plus persons today, we have vaccinated to date a total of 1,355 persons. I anticipate an even larger turnout as we expand the number of health centers delivering the vaccine jabs. I want to encourage everyone to get vaccinated. As I said yesterday, when I received the supply of 20,000 doses of vaccines, courtesy the Government of India, vaccination programs put us further along the path to recovery. Vaccination will allow more things to happen safely, more economic activity, and eventually economic recovery. My government's focus in 2021 is on economic recovery, and we want, of course, to do this safely. The emergence of the COVID-19 pandemic has impacted our economy and every aspect of life here in St Kitts and Nevis. In the early days of this pandemic, policymakers around the world tried to determine the shape of the recovery. Prospects for the global economic recovery were either optimistic or pessimistic, with some projections including a longer downturn and eventual return to normal, that is the U-shaped recovery, or a deep recession followed by a long and slow recovery, the L-shaped recovery pattern. Nonetheless, the prolonged impact of the pandemic continues in 2021, affecting countries at varying levels. For St Kitts and Nevis, despite the estimated deep contraction in economic activity in 2021, the economic outlook is forecasted to be modest, with an estimated growth of 5.5% in 2021 and 5% in 2022. As I mentioned in my budget address, for the 2021 fiscal year, we devise a fiscal strategy for the medium term, 2021 to 2023. One of the objectives is to facilitate recovery and reignite the economy by adopting a pro-growth approach to the development and execution of the capital. One of the objectives is to facilitate recovery and reignite the economy by adopting a pro-growth approach to the development and execution of the capital budget for 2021 and beyond. We expect that the key sectors that would drive our economic recovery would include construction, manufacturing, agriculture, ICT, and services, including tourism. Notably, construction activity, which generally contributes about 16% of our GDP, would be positively impacted by ongoing projects such as the resurfacing of the Island Main Road and other residential construction. The construction of other major projects, including the solar farm, the new Bastia High School, and health centers around the island, is also expected to contribute to the projected growth in 2021. Private sector construction activity, and in particular residential construction, will be significant this year. My government is making every effort to make a notable contribution to rebuilding the economy by continuing to provide support to various sectors through the provision of tax incentives and other financial and policy-based support. Examples of these would include the First-Time Homeowners Initiative, whereby duty-free concessions are provided on materials each year. Up to February 2021, duty-free was provided on residential building materials totaling $4.6 million. Tax exemptions on building materials and equipment were also provided for larger non-residential projects. We have the Government Employees Mortgage Program and the Citizens Mortgage Facility, all being executed through the Development Bank. With respect to the agricultural sector, this year we propose $15.8 million to boost production and ensure food security, the allocation of more lands for the farming sector, and the waiver of payments for the consumption of water by farmers. In terms of support to the small business development, the government will this year inject $5 million for the continuation of the Fresh Start program to provide access to capital to fund small and medium-sized business projects. We have also continued the stimulus offer of a reduction of the unincorporated business tax rate by 50% from 4% to 2% until June 2021. Tax exemptions have been granted also to many small businesses. We were heartened to see that the number of business licenses continuing to grow. For example, for the first 2 months of 2020, 143 business licenses were approved. For the same period, 2021, that is 1st January to the end of February, 183 business licenses were approved. In addition, we anticipate that the following policy options would further help to drive the recovery of the economy in an equitable and sustainable manner. In the short term, we of course have been investing more in vaccines, and we encourage persons to get vaccinated. This of course would boost consumer and investor confidence. There will be special focus on implementing our capital projects that are funded by external grants and those that would boost economic growth and productivity. We will continue to ensure prudent management of public funds by containing discretionary expenditure, and we will provide additional funding to support the Poverty Alleviation Program, the Severance Fund, and to sensitize the public on available social assistance programs. We will continue our investment in our health systems, including the construction of health centers and the renovation of our main hospital, the Drain France General Hospital, to ensure the delivery of essential public health services. We shall see the modernization of the public sector using more efficient ICT systems. We will employ more digital technologies in the education system, and we will see the use of digital transformation to improve access and quality of our public services, as well as for disease surveillance and outbreak response. There are several other initiatives which my government will be implementing in the not too distant future. Some of these, I am sure, when the Financial Secretary speaks tonight, she would address. Finally, of course, I want to indicate that on Monday, when we received the 20,000 doses of vaccines, we put St Kitts and Nevis in the forefront of efforts to ensure that we achieve herd immunity. I would want to call upon each and every citizen and resident to go out tomorrow and the days ahead to ensure they are vaccinated. The stakes are very high. Your safety, your protection, your life is at stake. So please do not hesitate. Please go and be vaccinated. I am pleased tonight to have with me 3 panelists. We have Dr. Dolores Stapleton Harris from the Ministry of Health. We have Ms. Hilary Hazel, Financial Secretary in the Ministry of Finance, and we have Ms. Raquel Brown, who leads our effort at tourism development. From the presentations that will come, I'm sure you will get a better understanding of where the country is heading, and of course, the role that you can play to ensure that we sustain the recovery, the economic recovery of our country. Thank you very much for tuning in.
Thank you very much, Mr. Prime Minister. We will now hear from the Permanent Secretary in the Ministry of Health, Dr. Dolores Stapleton Harris.
Thank you very much, Mr. Bryan. Good evening to everyone viewing and listening to this presentation. Firstly, permit me to congratulate ZIZ on its 60th anniversary and to wish the entity many more years of success. I grew up with ZIZ being a media staple in my life, and even with the evolution of the media, it has certainly remained an essential source of personal inspiration. I am indeed honored and humbled to be part of tonight's discussion alongside our illustrious Prime Minister, as well as my esteemed colleagues in the Ministries of Finance and Tourism. The focus of my presentation tonight is the continued rollout of the COVID-19 vaccine, the Oxford AstraZeneca vaccine, in response to the coronavirus pandemic, subsequent to the successful national launch on Monday, the 22nd February 2021, which aligns with the theme mentioned by Prime Minister, COVID-19, St Kitts and Nevis on the path to recovery. With our goals being to mitigate outbreaks and transmission of the virus, to protect the vulnerable populations, especially the seriously ill, and to minimize the impact of the pandemic on our health and socio-economic systems. The Ministry of Health is indeed very optimistic that these goals can be achieved with the support of citizens. It would be remiss at this time if I do not publicly commend all our residents and citizens who have been complying with the non-pharmaceutical protocols of meticulous and frequent hand washing, respiratory hygiene, wearing of masks, and physical and social distancing, which have been advocated by our healthcare team to combat the virus. Thank you for your enduring power as the Federation combats and awaited a safe vaccine. We expect, however, that you will continue with the protocols until you are advised of any relaxation. In addition, I must commend the staff of the Ministry of Health, particularly the members of the Health Emergency Operating Center, HEOC, nurses and doctors, and other frontline health workers for their expertise, dedication, and commitment in managing the virus thus far. I thank you sincerely. It is clear that our Federation has done well in combating the virus, with only 41 confirmed cases of COVID-19, 1 active case at this time, no death, and no community spread. But ladies and gentlemen, the fight is not over. The battle is still raging. We have to turn the corner. And with the statistics revealing approximately 50 million persons in the Americas are infected with the virus, it is imperative that we protect ourselves, our families, and certainly our beloved Federation. I am very pleased at this juncture, therefore, to assure the populace of St Kitts and Nevis, that our health system have been prepared for the quality rollout of the COVID-19 vaccine. But of course, having spent over $14 million in resources, we expect no less. In fact, within the Federation, we have already a best practice mechanism, the National Immunization Program of St Kitts and Nevis, with over 96% immunization rate, which is the envy of many countries. It is upon this existing, tested, proven, and good governance system that our COVID-19 vaccine plan is based for the effective administration of vaccines to citizens within the stipulated age group of 18 to 80. The program includes vaccine procurement, storage and distribution, and administration under validated cold chain conditions, as well as regular immunization training of designated staff. Undoubtedly, vaccine is not a new concept to our country, and one can conclude with a federal childhood immunization rate of over 96%, our citizens are accustomed to vaccination. It is well known that through the power of vaccines, our region has eliminated smallpox, polio, rubella, and measles. With COVID-19, it will be no different. Safe and effective vaccines will help us turn the tide of this pandemic. but only if we can reach a large number of our population, no matter where they are, no matter where they live. And we will still need to establish and maintain public health measures of testing, contact tracing, quarantine, physical distancing, hand hygiene, and masks until the pandemic recedes. So, fellow citizens, we now have the COVID-19 vaccine, the Oxford AstraZeneca Covishield, which we are rolling out. And yes, it is free of cost. Although there were considerable investments, $250,000 US to transport it to the Caribbean. We presently have approximately 19,000 doses of the vaccine in our central store, and we expect to receive additional amounts, at least 21,000 doses, through our procurement from the COVAX facility, the global mechanism working to ensure equitable access, which I am informed we will receive in the next few weeks. In addition, the ministry is exploring other avenues to access safe vaccines. It is important to note that the role of our public health system is to mitigate against morbidity and mortality caused by infectious disease at the population level, and vaccination does that. And St Kitts and Nevis continues to partner closely with our regional partners, CAFA and PAHO, to ensure our efficient rollout. Our vaccination plan therefore includes a comprehensive, robust communication strategy to guide the education campaign to inform the public and generate the expected demand for the vaccine. No doubt you would have noticed that such a campaign has commenced, utilizing traditional and digital media to disseminate the relevant content. There are many awareness education sessions. You saw the large gathering at Ross University last week with a broad cross-section of entities, and the ministry is continuing to educate actively and aggressively within the community with effective facilitators such as the CMO and Chief of Staff, doctors, and other members of the ministry's health promotion team. In fact, my presentation tonight is an element of this strategy. I will now briefly describe the process of vaccination. We are presently offering the COVID-19 Oxford AstraZeneca vaccine at the Newtown, Bastille, Tabernacle, Sandy Point, Old Road, St. Paul's, Keon health centers this week at 1 p.m. daily, Monday to Friday. Commencing at 1 p.m. is a strategy to ensure that all public health services are provided during the morning period, and there is focus on the COVID-19 vaccine administration during the afternoon. As such, the ministry is encouraging persons who are interested in the vaccination to go to the nearest health center and make an appointment for the vaccination. In fact, by next week, we will be building out the vaccination at all the health centers, all 11 health centers in St. Kitts. So just walk in, be vaccinated, or make an appointment to do so. I remind you that the vaccine is free of cost. Persons are expected to complete a checklist prior to receiving the vaccine to ensure they are fit for the vaccine and to provide data for tracking the vaccination administration. The COVID-19 Oxford AstraZeneca vaccine is administered by medical professionals as an injection of 0.5 mils into the deltoid muscle of the upper arm as 2 doses. The second dose is given 10 weeks after having the first dose. And it is important to return for the second dose to complete the vaccination process. The vaccine will not be given if the individual is allergic to any ingredients in the vaccine, and like any other drug, a history of allergic reaction to any other vaccine or therapies must be reported to the healthcare provider. Pregnant women and lactating moms are excluded from the vaccine. After vaccination, persons are asked to wait 15 minutes to monitor for the occurrence of any immediate adverse reactions, and the vaccination record card or certificate would be stamped and issued to the person and should be secured safely by the individual. On receipt of the vaccine, each person is given a list of possible post-vaccination side effects to look for and a contact number to call to report side effects as they occur. Therefore, I submit that the process is seamless, and I can assure the public that all relevant logistics and storage chains are in place for the vaccine, as well as an established mechanism to track and trace all doses of the vaccine as they move through the system. Of course, you are aware the ministry has already augmented its staffing with the input of staff from Cuba. And at this time, I am very pleased to indicate that in our further quest to bolster the human resource component of the vaccine rollout, several of our patriotic retired community nurses have come forward to assist in the vaccination rollout. I use this forum to urge others to come forward as we engage in our mass vaccination exercise. I am also pleased to inform that there are adequate amounts of syringes and needles to administer the vaccine. In conclusion, I wish to assure the population that the COVID-19 vaccine safety surveillance and pharmacovigilance mechanisms are central to our vaccination rollout. The safety of the vaccines and consumers is also paramount to the Ministry of Health. The vaccine was developed by a reputable entity with history of safe vaccine, so there is much confidence in the safety of the vaccine. So don't hesitate, vaccinate. It is your right, however, to ask. In fact, we do have a high literacy rate, so we expect citizens to ask questions and perhaps be somewhat hesitant. Nonetheless, I trust you to follow the science and be informed by the data. The statistical data are showing that it is a good thing to be vaccinated. And I am sure you are aware from global statistics that with the vaccination, there are now significant decreases in COVID-19 illnesses, hospitalization, and death. Isn't this a good thing? Citizens, no one is safe until everyone is safe. I wish to commend all who have taken their vaccines thus far. Thank you for your keen and enthusiastic sense of safety and protection of self and country. And for those who have not, while you may hesitate just a bit, do not prolong your wait. Vaccinate. It is not a rush for the vaccine, but an urgency to save life. I urge you to disabuse yourself of the false sense of security and make vaccination a priority. Thank you.
And thank you, Dr. Dolores Stapleton Harris. We will now hear from the Ministry of Finance, Hilary Hazel.
Thank you, Madam Moderator. Good evening to Honorable Prime Minister, colleague panelists, listening audience. With the approval of vaccines and the rollout of vaccination programs across the globe, there is an increasing optimism for global economic rebound and positive growth to return to most regions of the world. In fact, in January of this year, the IMF released growth prospects for the entire global economy. Global growth is expected to reach around 5.5% by the end of 2021. In the United States of America, it is expected that that region will grow by 5.1%. This is essential for us here in the Caribbean. Closer to home, Latin America and the Caribbean region, we're expected to grow by 4.1%. And for us here in the Federation, you've heard it from Honorable Prime Minister earlier this evening, that the estimate is for the economy of St Kitts and Nevis to grow by 5.5% in 2021 and 5% in 2022. This is consistent with all the projections made by the Eastern Caribbean Central Bank for the ECCU economies, which are expected to return positive growth in 2021. It is also anticipated, however, that the tourism sector would continue to be slow, with prospects for better performances in 2022-2023 tourism season. There is still relatively high levels of uncertainty as it relates to the prospects for recovery. The prospects are much more improved, however, for 2021 as opposed to our experiences in 2020. Taking a little deeper look at what's happening in the economy of St. Kitts and Nevis, we are expecting, as you've heard earlier, that the negative experiences we've had in terms of the construction sector, which saw a negative 16.5% growth in 2020, we're expecting now for 2021 a rebound of this sector, which will grow by 8.9% and thereby contribute in the vicinity of 14% to our GDP. The financial intermediation sector is expected to grow by 2.9% and contribute around 12% to GDP. Our real estate and business services sector is expected to grow by 2.8% and contribute around 10% to GDP. Public administration in 2020 was the only sector to experience positive growth, around 3.8%. In 2021, we expect this sector to grow by 4.3%, again contributing around 10% to GDP. The education sector, which also includes our offshore education facilities, would be expected to grow by 5.1% and contribute around 8% to GDP. In terms of our economic recovery and transformation, the pathway rests heavily on our ability to have both government and businesses, and I would want to add the general public, finding a way to coexist with COVID-19. It would also be determined by how well we continue to prevent or manage the spread of the virus within the Federation. This therefore underscores the wisdom in our government's early investment in vaccines and the strong advocacy of the government to ensure that as many citizens and residents as possible are vaccinated in the quickest time possible. Some critical issues for our consideration includes how soon the Federation would be able to safely resume regular tourism business and welcome both stayover and cruise visitors to our islands. Our ability to get things moving and to accelerate expansion in agriculture, manufacturing, and the development of small business would be crucial. How soon would we be able to make notable inroads to the digital transformation of the government and private business? The readiness and willingness of the private sector to invest in our country. We also have to consider the strength of the financial management mechanisms of the government, which must include measures to sustain a stable fiscal environment, stimulate economic growth, economic transformation, and maintain adequate social safety net systems targeted at the most vulnerable members of our society. The areas of focus, therefore, would be critical as the crisis offers many opportunities for us to accelerate important reforms. The overarching goal, therefore, has been accepted and currently being worked on by the government, and therefore is embedded in our 2021 budget. And a number of our public entities have also embraced it and have set plans in motion to achieve better results over the medium term. The strategic direction of the government is to support recovery of the economy and to sustain that recovery anticipated in 2021 into the medium and long term. An important element will be to improve access to reliable, affordable, and sustainable energy sources. This, we believe, could be achieved by pursuing opportunities for increasing alternative sources use of energy. The most important project at this point in time from the government's perspective is the solar farm that is soon to be developed by Skelett. The government would also have in its arsenal the review of the existing legislative framework to support additional investments in renewable energy. The private sector and private individuals are also encouraged to seek out opportunities for integrating renewable energy, such as solar energy, into their daily use. Implementing reforms and the various plans necessary for digital transformation is of optimum priority. Our experience with the impact of COVID-19 leaves no doubt that the government is on the right path when it launched its digital transformation strategy. Work is ongoing within government, and some elements of the digital transformation agenda would be rolled out by the cable during the course of this year. The government has also adopted, as you've heard earlier from the Honorable Prime Minister, a pro-growth approach to the development of the capital budget. During 2020 December, the National Assembly approved a capital budget of $192.7 million, of which over 70%, $141 million, would be used directly to impact the construction sector. So, in summary, we are going big on construction. To date, some projects that were rolled out from 2020 are progressing towards completion, and others are moving from the design phase to implementation over the coming weeks. We anticipate that these investments along with private sector investment projects planned for implementation, would help to boost the construction sector and deliver positive growth, provide employment, and improve overall our physical infrastructure. Another critical element of our strategy to assist with economic recovery is the leveraging of the platinum brand of the CBI program. We also intend to continue supporting the development of the agriculture sector and manufacturing. In terms of the agriculture sector, support for agriculture is important for boosting food and nutrition security of our country. The agriculture sector is fully supported in the current budget to continue enhancements in the production capacity of the sector. There are multiple objectives, which include lowering the food import bill, creating employment and business opportunities for our people, and, as said earlier, enhancing the country's food and nutrition security. To achieve success, we have to work to overcome the challenges that have impacted the sector for many years. These include outdated and inefficient production methods, which leads to high costs of production and high costs of produce, the lack of adequate irrigation and other important infrastructure. Lastly, destruction of crops by pests such as monkeys and other feral animals. The commitment of the government, therefore, extends beyond the resources spent in 2020 as part of the stimulus program. The commitment also expands beyond the resources earmarked in 2021. The commitments are also extended to a commitment to continue the modernization of land use policies, tackling predial nasally, and intensifying pest control. We are also on the move to improve the technical support to farmers, promoting investment in water infrastructure to support crop production, embedding the use of technology in farming and fishing in the Federation, promote buy local, eat local at the national level. There is no way of securing good results in terms of stimulating economic recovery without giving continued attention to the active plans for human resource development and legislative reform. This evening, I would end on a similar note to the last time I was invited to join this discussion on leadership matters. And that is to say, it is clear that actions that the country must take are numerous, and the government cannot be expected to do it alone. The private sector would have to play a significant role. There is also a role for each individual citizen and resident. At the government level, we have identified some of the key initiatives to be implemented in order to support economic recovery and transformation of the Federation. We believe if the private sector, the public sector, can join together to implement a realistic program of action, St Kitts and Nevis, the St Kitts and Nevis economy will rebound to positive growth by the end of 2021 and also to sustain that growth over the medium term. Thank you for your kind attention.
And thank you for providing us with that important update. We'll hear now from the Chief Executive Officer at the Tourism Authority, Raquel Brown.
Thank you, Jacqueline. Good evening to my fellow panelists. Good evening to the Honorable Prime Minister. I have the honor of hopefully providing some confidence for those of us who are in the tourism industry. For the last year, for many of us, it has been extremely difficult time. The travel and tourism industry was the most hardest hit throughout the world because of the global pandemic. At the end of 2020, when the borders opened for many destinations before us, we opened our borders on October 31st. We saw many destinations open as early as June, and for many of us in the tourism industry and many of my stakeholders, they were very antsy and they were what's happening. We've seen many evolutions of what has happened. We've heard of bubbles. We've heard of cruise tourism restarting. However, our protocols, and even though we were the last independent nation in the Caribbean to reopen, have helped us to be in the position that we are in now to help us to promote tourism and travel again to St Kitts and Nevis. We're not gloating, however, it is important for us to share with the world that sees St Kitts and Nevis about what we have to offer. But before we do that, we have to educate them on how we've managed the pandemic. And to the help of our CMO and to the task force, we've managed to have no deaths, no clusters, and no community spread. And with only 41 cases, it is a very it's an extreme accomplishment. And last week, Minister Grant and I were on a call with cruise line partners for the Eastern Caribbean, including Jamaica, and everyone was quite shocked at how St. Kitts and Nevis, our other tourism cruise partners, we had managed and mitigate the spread of COVID-19. What was sad as they gave their updates, every other nation, every other country that was on their cases were over in the hundreds. So we must be grateful that we're in the position that we're in. We are quite optimistic. I am optimistic, and so is my team. It doesn't mean that we will not have challenges, but we'll be rebuilding tourism, and it will be a process and it will take time. I will start quickly with cruise, because cruise is going to be the one that is most dependent on the vaccination rollout. To date, the CDC and the Biden administration in the United States, they have not moved forward with test cruises that were to start this month. However, we wait and we hear what they have to say. But what is clear is that there is one cruise line already, and it is Crystal Cruises, and it is one of the most high-end cruise lines. They do come to St. Kitts. They've come to St. Kitts in the past and to Nevis. They have already indicated that they will require all cruise passengers to take the vaccine. So we see that in the marketplace already a demographic of cruisers are going to be required to do this, to have the vaccine. Cruise, so we wait. We wait to see what happens. We haven't had test cruises yet, which will be the preliminary state for passenger cruising that they hoped would have started sometime March, April. However, we wait to see what happens, but we do know that the vaccination rollout is going to be very essential, and it is going to help in building out itineraries that St. Kitts and Nevis will share. For stayover tourism for air arrivals, we opened in October, and we know that we've had visitation, but only about 25% of those persons were vacation in place, international travelers versus quarantine for returning nationals and residents. However, what is important to note is that the persons that are coming to St. Kitts and Nevis, from the information we have received, is that where they do stay speaks to the demographic of Four Seasons, the Marriott, and Park Hyatt. So those persons are very intrigued by the destination, even though we still do not have the numbers that we had previously. They chose St. Kitts and Nevis because of the travel requirements. Some of them have said it was very strict, but when they got here, they said, oh, this is why. So at the end of the day, as we move forward into Q1, we thought it was important for the first quarter of 2021 to speak through PR to get the word out about how we had done over the last 3 months. And over the last two I would say over the last month or so, Minister Grant and I have been doing interviews with very esteemed media persons who can get the word out about St. Kitts. Minister Grant has done an interview with eTurbo News as it speaks to the destination and